Hey everybody, I'm Sherry and I'll be meeting with you guys for the next couple of weeks to do your post-conference Zooms for your Adult Health 1 virtual sims that you guys are going to be doing. I'm very excited. I enjoyed my first group and we had a really great time during our hour-long sessions, really kind of getting into the patients that you guys have on your virtual sims and expanding on some of the potential things that could happen with this patient if you were actually to have them in the real world as a live patient in a hospital. The first thing that I want to go through is kind of some expectations about what we are going to be doing with this Zoom. I really am hopeful that you guys will be super interactive. That is the best part of learning, is when everybody gets in and starts talking and really asks questions. Don't be afraid to feel like a question is dumb or that it's not, appropriate to ask. If you have a question, ask it, because somebody else might be thinking the same thing and me answering you is going to answer them by proxy. So I'm really looking for everybody to be very interactive. I don't try to call people out and, choose them to answer questions. But at the same time, if everybody's just sitting there not really responding, I will kind of pick out people and try to guide the conversation a little more so that we can really get the best out of the hour we have together each week. It is a very weird time right now with COVID, and I know this is not the preferred way for learning, but I'm finding that with the students that I've been working with, we're really making the best of it. And that's, my hope for us as well, is to get as much out of it as we can. So paperwork is due by Saturday evening at 23:59, which is 11:59 at night. I do, like I said in my email, check to see what time those get submitted. So if it is late, I will be reaching out to you to address that, just because it's very important. Given, the hours that you guys are being awarded for the work that you're doing, that you're on time with your paperwork. That being said, paperwork is a learning experience in my opinion. So if I were to grade your work and feel like it needs a little bit more love and attention, then you'll know. And it's not a punitive thing. It's that, we just really need to be getting the most out of this paperwork and not just doing it haphazardly for the sake of handing it in, because this is a very important thing that you're doing. And, we're trying to make it as parallel to the actual experience of having a patient on the floor. So when it comes to the paperwork, I have it right here in front of me. I just kind of want to go over the expectation. And again, we can talk about this at our first Zoom, because that will occur before the paperwork's due. But a few things I wanted to point out that I noticed with my last group was on the top part of the paperwork where it says client code status. They're talking about whether or not this patient is a DNR or a full code. And the expectation in healthcare is, if you don't know the answer, then you always default to full code. You never want to assume somebody's a DNR unless you absolutely know, because that's an important thing. And with your VSIMs, I know there's a lot of pieces that they don't get as in depth with. But I encourage you, if you're finding that you're doing your paperwork and you're not able to answer some of the questions on the paperwork, you may need to go back and revisit the sim and do it again to see if, you didn't get as deep into the information as you could have. So I do encourage that. When it comes to this history section here in the paperwork, why did this client seek medical care? Another thing that I found with my last group that we had to talk about was they're asking, why did the patient seek medical care to begin with? So for example, we had a patient last group that was a knee replacement patient. The reason he sought medical care was for pain in his knee, and then the primary medical diagnosis ended up being a right knee arthroplasty, meaning he had his knee replaced. So when you get to that first part of the paperwork, when they say, why did they seek medical care, think, what were the symptoms that made this person need to go to the doctor? And then the primary diagnosis is going to be, why are they in the hospital and we're caring for them? What is put them there? Which sometimes is the same thing and sometimes is two different things. So that's what they're looking for there. The pathophysiology piece of it, I really want you guys to, try to be as in-depth in that section as you can. It does say to say it in your own words. And I think what we're trying to have you guys practice in this portion is, if you were educating a patient and their family in the real world, how would you talk to them about this specific diagnosis? You could ramble on with medical terms for an hour and they're not going to understand it because they're not in the medical field. most of the time. So when it comes to that section, really put some thought into it and think about how would you explain this if you were explaining it to your loved one who didn't have the knowledge that you have. Past medical history and past surgical history for these VSIM patients. I feel like sometimes you get that information, sometimes you don't. If the patient has a surgery as part of their VSIM experience, make sure you're putting that in the surgical history portion because it is now considered part of their history. And then past medical history, anything you find out, put that there. The more that you have there, the better you're able to take care of a patient. Vital signs is pretty self-explanatory. You'll put the vital signs in there. Pain. One thing that I also noticed with my last group that I really want you guys to focus on is give me some descriptors of the pain if they're given to you in the VSIM. Pain is pain, but the type of pain can really help guide your nursing practice and what might be happening with a patient or how you care for them. Because a sharp pain versus a throbbing pain could be two different things, even if they're in the same location. So that's something I want you guys to think about when it comes to that portion of the paperwork. The physical assessment, again, neurovascular respiratory, really look at the guides that it's giving you on the paperwork where it says abdomen soft, non-distended, active bowels, last BM, regular pattern. Look at that and let that guide your answer and answer it as thoroughly as you can. Again, if you're finding that a lot of these sections are blank, I would encourage you to go back to the VSIM and go through it again and see if there's more you can do to elicit that information being given to you so then you can fill it in here because a patient is a whole person and the body works together. So you may have a patient that in the VSIM is there for, let's say, an abdominal issue, but when you assess the cardiovascular system, you find something there and then it turns into something else, which is how a real human in the real world is going to be more likely to happen. I know the VSIMs tend to be very focused sometimes on whatever the specific thing is that they're teaching you, but I really want you guys to take that VSIM and then for us to expand upon it if it were the real world. What are some other things that could happen? Discharge considerations, that's something that you guys really should be working on too. Just thinking about, if this were me, what do I need when I go home? And that'll be very relative to the patient and the region that they're admitted in the hospital in the VSIM. Intake and output, catheters and tubes and all that stuff is, like I said, pretty self-explanatory. Things are important, like the date that it was inserted or the site or the size. So make sure you're putting those in if you have that information. Diagnosis tests and dates, findings, impressions, indication. Really try to think a little more thoroughly, again, if your patient has some kind of diagnostic test, whether it be a chest x-ray, EKG, something like that. Try to be thorough with that. When it comes to the lab value stuff, obviously I want you to fill in what you get for information from the SIM, but I really want you to be thinking about why are we doing these testing? Why do we care what somebody's H&H is if they're not a surgical patient? Or, there's just a lot of talking we can do to that as we move forward when we go over these VSIMs. So I want you guys to really try to expand beyond just what is happening for this particular SIM patient. So there should be in that indication and interpretation section, I want to see, some thinking. And, the indication is probably going to be pretty consistent for most things because, white blood cell count, we look at that as a marker for infection or inflammation most of the time. That's kind of the primary usage. So, you're not going to have to change that in the next paperwork because it's going to be fairly consistent. So put in the work. The first round of paperwork, you'll actually find will probably be a little easier moving forward because you'll already have some of that information there. Other labs, make sure you're adding those in if they are part of the SIM, because if they're part of the SIM and they're not on the paperwork, it's probably important to the reason your patient is in the virtual SIM. When it comes to medications, I want that to be very thoroughly filled out, but one thing I really want you guys to focus on, and this is part of your learning as you move forward and that's going to stick with you through your nursing career, is the nursing considerations. And that is very important to be aware of, not just the dosage and the side effects and this, that, and the other thing, but how it works in the body and what do you need to look for as a nurse about what it could do to the body when you give it. So in that nursing consideration section, I'm really looking for some good information, both how you would teach the patient and what are we looking for as nurses. An example, metoprolol is my common example because that's one that we're very commonly checking a blood pressure and a heart rate prior to administrating this med, because that particular medication can affect those two things quite severely depending on where the patient is starting as a baseline before we give it. So that's very important, and it's something that I will tell you, I have ABSN students that are juniors, and as we get into the actual hospital acute care setting, those are very important sections in your paperwork. So if you can get a handle on it now and really understand it sooner than later, it's just going to help you that much farther moving forward. Care plan is, this is kind of the nitty gritty of where you start thinking about what this patient needs. Top 3 nursing problems or priorities. I'm going to tell you now that, there's going to be the 3, you're going to do them, and then you're going to answer the subsequent questions related to the first one. I'm going to ask that as we move forward through the 3 weeks, that whatever your top nursing priority is for the first patient, you pick a different one for the second and the third, even if, let's say, risk of infection is the top nursing priority for the first patient, even though it might also be a top nursing priority for the second patient. I'm going to have you look at that patient a little more thoroughly and pick a different one so you can expand upon it in your paperwork. So just keep that in mind. And again, we'll talk about all of these things during our Zoom post-conference. This is literally what it's for. And then long-term goals and short-term goals. I don't want to see just one. I'm looking for 2 or 3 of each. And I want you guys to really think about the patient as a whole person and have your first long and short-term goal be directly related to their reason for being admitted to the hospital. But then think about other things that stem out from that. And we're going to pick goals that relate to other pieces of the puzzle for that patient. And this is where these Zooms are going to be really great, because a lot of the hour that we spend together, we're talking about this, and I'm giving you examples or, helping you guys think a little farther down the line of, okay, risk of infection is number 1, but, so now we want to have a long-term goal of a patient being infection-free, within 30 days, let's say, to then looking at that patient and wondering, well, why did they get the infection? Was it because, they're an IV drug user? So then a second goal could be that the patient would, look for therapies and community supports to help beat their addiction, which then in turn is going to keep them from getting an infection. So we really are going to dissect these VSIMs apart a little bit and really look at it a little more globally, which I think is going to be helpful for you guys. Interventions and rationales, I would like to see quite a few of those. There's never just one intervention and rationale for that intervention with a patient. There's a million things you can do with any patient. Some of them are pretty standard across the board for everybody, and some are very specific to the disease process or the reason for their being admitted. So we'll talk about that a lot too. And then, the reflection piece, I really want you guys to think about that a little bit. I read all of the paperwork, but I read those specifically, and I try to gear and guide my following week's post-conference with you guys based around what you guys are telling me about how you're feeling about the VSIM and how you felt about the paperwork. So make sure you're honest and thorough. And right now this is learning, and this is a very safe way to learn with these patients because they're not real humans. So if you mess up, it's okay. Now is the time to mess up. Now is the time to say, I don't know the answer to that question, and really dig into it and figure it out. And to really start thinking in a way that is, how you're going to think once you have a real human in front of you and you don't have days upon days to be able to, rethink and redo and go back to the VSIM. That's, what this is all about. So that's kind of my brief yammerings, if you will, about the paperwork. The VSIM portion of it, like all of the actual online stuff, is due by midnight the night before our post-conference. So for you guys, it'll be midnight on 11:59 p.m. on Wednesday is when all of your online stuff should be done, and then we'll meet the following Thursday. I do have clinical with my ABSN group that day, so 6 to 7 is the time we'll be meeting, and it's worked out pretty well last semester with my other students, so that should be good. And I'm always available by email, always available to answer questions if you need. I am pretty readily available to a computer because if I'm not doing this, I'm at my actual job and I'm in front of a computer. So That being said, I hope you guys are excited to start with me, and I look forward to meeting you guys next Thursday at 6 p.m. The initial email that I sent out had the ID for the Zoom meeting. That will be this consistent ID that we use throughout the 3 weeks. And we'll go from there. If you have any questions in relation to this particular video, just let me know. The email that I'm going to send this video in, just respond to that thread, and try to reply all if you can. If you have a question that isn't, unless the question is specific just to you, then you don't have to do that. But if it's a general question that everybody can benefit from the answer from, respond all. That way you can ask the question to me with everybody being aware, and then I can respond and everybody can see what the answer is. I think you guys will be in a pretty good spot because you've already been on the floor at New England Rehab, so this should be pretty easy of a transition for you, but I really want to make sure it's as easy as it can be. So let me know if you have any questions, and I look forward to seeing you guys next week.